Try this again, and I am going to add Nurse Yalda. So hopefully you can hear me. I don't know if you can hear me. So, well, that's good. Hello, I hope you can hear me. Just let me know if you can hear me or not. You could just message me. I have actually invited Nurse Yalda, so hopefully she'll be joining us shortly. And if I can't wave to you quickly enough, it's because I can't touch the phone. Um, oh, good. So Tina said that she can hear you. Somebody else, Airy World, thank you very much for joining us from Korea. Erickson Buchanan. Oh, good. Well, I hope that Yalda joins me soon. Let me try to invite her once again. But um, we'll be talking about anatomy and we'll be talking about injecting and aesthetics. So thanks for joining us. And Nurse Yalda is unable to join. So she joined, and why is she not able to join? So I just invited her again. There you are.
Hello, yes, and it's working now. Hello.
Oh, you can hear me?
Yes, I can hear you. I think now it's working perfect. So technology can be amazing, but hey, sometimes technical difficulty here and there just makes everything more exciting. Why not?
Yeah, I don't know why, because anyway, some people could hear me talk, other people couldn't, and then their parts to make a difference. But thanks so much for joining us. And I know that you're an amazing injector, and I'm excited to be part of your amazing course. Did you want to talk about it? Did you want me to torture everybody and talk about it?
Go ahead. Go ahead. First of all, I just want to take a moment to thank you guys. Dr. Roy Kim, he's an amazing plastic surgeon from San Diego, and he's been such an amazing, supportive, kind, um, such a great example for me, myself. And I can see how humble you are, but I can also see how amazing you are to motivate others, whether other nurses, other doctors, to motivate us to learn and grow together. So I'm so lucky to first to get to know you, and I'm so thankful for you to believe in me and willing to share your experience and coming all the way from West Coast to East Coast and share your knowledge with others. So thank you so much for such an opportunity.
Oh, well, you're too kind. I mean, it's a lot of fun injecting. It's a lot of fun getting to know you. I don't know if, first off, this course is going to be awesome, Cadaver Art Aesthetics, because the first day, Friday, it's going to be about ultrasound, anatomy, and fillers. The second day, it's going to be about cadaver or bioskills demonstration lab or something, as well as anatomy and fillers as well. So I'm looking forward to be part of the faculty for the cadaver course. It's going to be a lot of fun learning, and it's going to be in Washington, D.C. So I guess this is one of the first cadaver courses in the Northeast, correct?
It is. As far as my knowledge, this is really the first cadaver course in DC area, and
Hmm.
so many amazing other courses that so many of my colleagues they are having. They're offering so many great master classes. But as far as a cadaver course, this is going to be the first one, and I'm so excited. And I feel like at the end of the day, my number one goal goes back to our patients. The best outcome and the best techniques that we can learn from each other and be able to provide the best for the patients.
I agree. It's always about patient safety. I mean, that's actually the most important thing. It's not even about getting good results. You want to deliver good results with patient safety. So the emphasis, of course, is on anatomy, knowing your anatomy. I do think this course is maybe for beginners for ultrasound and also people who really want to dig into the anatomy and figure out what should we do in terms of injecting right on the bone, above the bone, subdermal, close to the skin. Some of these subtleties aren't really taught, or they're sort of taught, but it's better to actually see it in person.
Absolutely. And I think, especially as far as my background, a lot of nurses, this industry is growing, and a lot of nurses, they are becoming more and more involved. And we do learn so many things, which is amazing during nursing school. But then the minute you do graduate, then you're like, okay, what's next? And we're so thankful for so many companies that they do support us. They give us so many tools to learn and grow. But I believe one of the things that perhaps in my career was missing, that truly learning the facial anatomy. And it's funny, this is actually one of my
Oh,
favorite,
you just happen to have an anatomic head around. Yeah.
actually. And we're just hanging out.
Yeah.
The reason why, because facial anatomy matters, and I know a lot of whether doctors, surgeons, you guys have more hands-on training when it comes to facial anatomy, learning that deep and dirty when it gets to real, like where there is muscle, fat pads, a bone. And I think now that we're having more and more nurses involved, I would love to, one, have other folks just like you, that you've been doing this longer than so many of us, to just to share the knowledge and share the love, and provide support for one each other.
Yeah. Yeah. No, I totally agree. And getting back to just anatomy, what I was trying to say before, which no one heard me, you've probably seen that photo where somebody got jawline filler, but then on a close up, it was given completely superficially, and they were talking and it was moving around and it wasn't given really at the right depth. It was actually given in the right area. The outline was completely correct, but this is something where you needed an anatomy, where you need to give a lot of it deep or deeper or even periosteo, and then some of it superficial. And so when you're talking or moving your mouth, it actually looks like it's part of your jaw.
Exactly.
So that's some of the stuff that we're going to learn in January. And the other thing too, which is another hot topic, is the ultrasound course.
And why ultrasound? Why, what, as far as your knowledge, why would you say ultrasound? Because I've been doing it in the past year and a half. But what are your thoughts on that?
If you are a little newer to anatomy, I do think that ultrasound's helpful because you know how deep or not deep you're giving something. You can see the needle edge, you can see the depth. Also, it's very useful to document things, which I think our world needs. Documenting where you injected it, documenting, okay, if you need to melt stuff, where is it? Are you melting it? Is the actual melting agent or cannula or needle where the old product is? If you could document it on ultrasound, it's very difficult to, say, oh, you didn't melt it or you didn't melt enough or whatever. So I think that's very key.
Absolutely. No, there's so many great providers that now they're taking leadership when it comes to teaching ultrasound and aesthetic, and it's becoming more and more handy again, especially to some of the providers that they're more new into the industry, and it goes back to the patient safety. And based on my experience, one of the benefit to this ultrasound is sometimes if there's a complication, whether it's occlusion, and it just gives you that peace of mind. So for so many people who are joining us on this live, and I appreciate everyone's support. Again, this course is going to be for, at the end of the day, our goal is to provide the best result for our patients, safety, learning facial anatomy. Our wonderful faculty are Dr. Roy Kim from San Diego, one of the amazing plastic surgeon in this area, Dr. Rotana, and then we have three other faculty. One, it's me, and then we have a nurse practitioner. Her name is Nurse Rona, and then Ashley, also from DC. So we're having one of the best and the best in the industry gathering together to spend the whole day together. The facility will be at Inova Fairfax Hospital, which is very close to my practice, and it's going to be where we're all going to stay for folks that they're coming out of town. And it's like almost 5-10 minutes drive from the hotel that some of the folks are going to stay. And I know Fairfax Hospital is one of the top teaching hospital, level 1 trauma hospital in the DMV area. But also they have one of the best learning facility, and we are just utilizing their learning facility for that one day for our course. And this is so exciting. And I hope this is, as I always tell everyone, this is just the beginning. And more excited for more future, brighter future. And why don't you tell us about the exciting course that you and your business partners having? Because I know you guys are also focusing on other things that I think it can be very helpful for other nurses, nurse practitioners.
Yes, I've been working with Nurse Eunice. She is a fantastic nurse injector from Southern California. She injects in Beverly Hills. And we met and we hit it off, and we decided that one of the things that she mentioned was in her journey to be a nurse injector, there's no course. There are courses to become CRNAs. There are courses sort of to become an ICU nurse and work in an ER setting, but there's no course to become an actually great nurse injector. A lot of the courses are ripoffs. So she took them, you may have taken them where they're sort of pricey, but there's not much hands-on experience, or they're less expensive, but they last for like 2 hours and they don't, or 4 hours, they don't really teach you much. So we wanted to focus on giving you a course that teaches you the basics, teaches you what you need to know to get a first job, actually help you network, go over resume writing, and get a first job, and then go from there. So it's called Injector Residency. We have a website, we have an Instagram feed, but that's our main focus is converting the mindset as well as the skills from being an RN or NP or PA to getting a job. So many courses, they don't help you get a job. I think the other thing you mentioned is that, hey, we get a lot of benefit from hooking up with industry, with Allergan, with Galderma, with other companies like that. And sometimes it's harder to get those free courses. Sometimes you have to be associated with a practice that is doing a certain amount of higher volume to be allowed to go to that course. None of the courses can teach you off-label use because they're not allowed to. And finally, a lot of it is not that hands-on. They've only recently started changing that, but it's not like you get that much hands-on.
Right.
With Nurse Eunice and me, we're like staring at you while you inject a live human being. So that's the difference. And I guess the other thing is you're getting it from the perspective of the nurse and the medical director. So I'm a plastic surgeon, I'm a doctor, and my insane, crazy opinion is very different from a nurse or mid-level injector. And if you can understand both worlds, it's going to be smoother sailing because some injectors think I need more money, I deserve more money. And sometimes you do, and sometimes you don't realize what the standard is. Medical directors sometimes view, injecting as annoying or just, a side hustle, whatever. And it's not that all the time. I mean, some of these results are amazing. So this is why I do think it's helpful to get it from both perspectives.
Absolutely. No, it's a great point of view. Like I think always I have enjoyed speaking to plastic surgeon or other doctors because everyone different point of view will help you understand one each other and learning from each other. I think that's what makes you, whether a plastic surgeon or a nurse, to grow. Because in all seriousness, I think even I learned so much from my estheticians, and I admire how knowledgeable they are when it comes to skin and skincare, and that's like the foundation of a beautiful face. You can do so many plastic surgery, but what's the bottom line? You want to have a beautiful, good quality skin. So I think in our industry that is growing, it's super important to focus on all the elements, like whether it's skin, whether it's injectable, whether it's seeing your plastic surgeon. As you mentioned, it's so important to, yes, become a nurse practitioner, take these courses, but then what? How can you find a job, especially as a new brand new nurse injector? Where do you go? Who do you contact? And it's difficult. Like I remember when I wanted to look for my new position, it's a difficult thing because as ICU nurse, you go to the hospital and you go through the residency, they hire you, they train you, and then you go from there. But in our industry, and I know it's growing, it's exciting, and I love it more than anything, and I want the success for other providers. So back to Cadaver Art Aesthetics. So I hope you guys like our logo. I think
Yes.
logo. We do have a little C and an A. There's a sculpt, and then the A is like a little woman's face. Cadaver Art Static, again, is our goal is to teach, to share our knowledge. And I know there's so many other amazing cadaver courses, but at the same time, I do have so many colleagues that they have children, they have family, and traveling is hard for them. So I'm so excited we can offer this course for the first time in DC. And I'm just so excited.
So, if you want to go with the audience, what the exact days are, which hotel is it located at in January?
So for folks that they're coming out of town, we're going to have a contract with for a group rate in Ritz-Carlton and Tysons. And I know that's where you and Eunice are staying. And so on Friday for the ultrasound class, which is going to be taught by Danny, and I'm the one who took her course about a year ago, and she's phenomenal. She's really one of the top in the industry when it comes to teaching the ultrasound. She's a physician assistant. She has many years of experience in emergency room, and I think that's where she combining her knowledge as far as being a PA at emergency department and being a physician assistant and having her own practice and doing aesthetic work. So she's excellent when it comes to teaching to ultrasound, especially when it comes to ultrasound. A lot of people are like, how am I going to be able to learn how to read ultrasound in one day, in one course? How do I know what am I looking at? But it's so phenomenal the way she explains and she teaches this course. She breaks it down so easy that almost what you need to look for, whether it's the bone, whether it's the artery, whether it's just the filler that you need to dissolve. So almost she explained in such a simple way that almost you learn what you need to apply in your own in a day-to-day seeing patient with the ultrasound. So that's that's January 20th, and
That's Friday, January 20th.
exactly, and that's going to be in our conference room at Rejuvenation Clinic.
Okay.
And that's also just 5 minutes away from Ritz-Carlton. It's very close. Everything is very local.
It's
And
in Tyson's Corner, correct?
in Tyson's Corner, yes.
Yeah.
Next day, Saturday, the class starts at 9 a.m. It's going to be at Inova Fairfax. Again, it's very local, about 10 minutes away from Tyson's Corner at Inova Fairfax. And the course starts at 9 a.m. And in the morning, the didactic part will be between you and Dr. Ratana. And then we'll take a quick break. We're going to do lunch. And then from 1 to almost 4:35, we're going to do the dissection. And the dissection, we're almost going to have between 20 to 25 students. And how we're going to break it down is almost each station is going to be between 4 to 5 students and one cadaver. And between you and Dr. Ratana, you're all going to do the dissection part, explaining the anatomy. It's going to be on a big screen TV that everybody can have a good vision. And each almost student will be able to do one side. And then as we're also going to have the opportunity to inject fillers, and then dissecting and then knowing exactly where we place the product. Was this a superficial injection? Was this an injection to the periosteum? So kind of giving us a really nice detailed picture that, okay, when we're doing our injection, where are we really placing that product? And whether it is for jawline, whether it's for enhancement of the mid-face. So, and of course, going back to safety as far as certain area, I know there are some providers that they refuse to do non-surgical rhinoplasty. There are folks that they refuse to do temple or non-surgical frontoplasty. So really, going explaining the safety part of the all of this dermal fillers.
Yeah. So that's Saturday, January 20, I'm sorry, Friday, January 20th, ultrasound. Saturday, January 21st, cadaver.
Exactly.
Yeah.
And as far as the registration, we do have the link on my page. It's on the bio. Everyone, we still have spot available, and we're just happy and excited. And I appreciate everyone's love and support.
Oh, great. Well, we got a comment. Any possibility of education of the neck, just because the more injectables now being injected to the neck in the décolletage. I'm probably mispronouncing that. Décolleté. The lower neck, upper chest area. Is the neck available to show how to treat the horizontal lines?
I think this is such a good question. I appreciate that. Actually, again, because we're working with a big hospital, and they're one of the big trauma hospital in Northern Virginia. We're very blessed to have them, and they're very open to be as supportive as possible. So maybe this is going to be an email that I can send tomorrow, and I can CC you, and we can ask them what can we have.
Yeah, yeah.
As far as requesting for the cadaver, what can we really have? So yeah, that's something. I appreciate the question.
Yeah, and then of course jawline, sort of like lower face, upper neck area, that's going to be included. So that's a gimme.
Absolutely. No, we're going to have fillers. We're going to have injection of filler with needles. We're going to have injection of filler with cannula. The filler is going to be mixed with dye. So when we're doing the dissection, we're going to be able to differentiate between our placement of the filler, whether it's periosteum or more like a superficial placement of the filler.
Oh, cool. And then somebody stated that their neck is available. If they sign a waiver, can we inject them for fun? And then I'm just sort of joking here, but I guess I'm sort of serious. I mean, you could inject live human patients in Virginia if it's possible.
I think we do. I think I can, again, we can, these are such a great questions. We can send an email and speak to the director of Inova hospital and see what are our options. I mean, I would say why not, but one of the questions that actually one of my patient or one of the, sorry, I just got a phone call. One of the question was, there are a lot of treatment when it comes to Morpheus 8, ultrasound, therapy, radio frequency, and then one of the students was asking me, can we do a treatment on this cadaver by placing the filler and doing this radio frequency and see if we're going to melt the filler. So I think we have many options, and I think at the end our goal is to learn and then also teach. So
Yeah.
anything.
So I think another thing too would be threads. In other words, as a surgeon, I'm not in love with threads, but we could place them and then you could see exactly the depth as to where the good placement of thread would be, where bad placement of thread would be, stuff like that.
And
Yeah.
I live. So these are some great ideas that actually I wasn't even thinking. But no, I do video thread not on all of my patients. I think there are patients that after a certain age they really need to see a plastic surgeon.
Mm-hmm.
There is a time and limit for everything. I'm not a big fan, especially when it comes to pedio thread for rhinoplasty and so many areas.
Yeah.
So I'm not a big fan when it comes to brow lift or cat eye. But if there are certain area that a patient still they're young and they're still looking for a little bit of a lift and they're still in their early 40s, maybe, yeah. But after a certain age, if they have excessive skin, the best investment for them would be to see the board certified plastic surgeon, because that's really at the end we want the best for our patients.
Yeah. I think another question I had was, can we do live human injection with the ultrasound day, with Friday?
Oh,
So,
absolutely, absolutely. We're going to have models.
oh, good.
Definitely, that's something that we're definitely planning. As far as the ultrasound, something that I do want to share. Danny, she travels the country and she has her own courses in her own practice. But at the same time, we have 4 more spots available. So for folks that they're interested, the link is available. So please be mindful. We can't make any exception. I know last minute things always happens, and providers want to register last minute, but since we still have some spot available, this is a perfect opportunity. So please take advantage of it, because she's very busy and she has children and she's coming all the way from Chicago actually. So we only have 4 spots for her left. So there's not much spot left in her case, because
Gotcha.
she cannot see anyone more than what we have. But for our course on January 21st, we can have up to certain numbers. We're not limited. So that's the only difference.
Good. Yeah, and this course, I mean, I keep on thinking it's so far away. It's like 7, 8 weeks away from
No, we're almost there. I know.
now.
We are done with 2022 almost, like
I
towards
know.
December. So yeah.
Yeah. Well, great.
Well, thank you so much for your time, Dr. Kim. I know you're a busy man, but we truly appreciate everything you do and everything you have done for us. Thank you.
Oh, well, thank you for the opportunity. It's going to be a lot of fun. I do enjoy and love fillers, especially, to me, the geek stuff, the complicated stuff with anatomy. So giving it deep, giving it middle, moderate, giving it superficial, and patient safety. Those are the important things.
At the end of the day, it's all about patient safety. Totally.
That's right.
I appreciate everyone joining this live. Thank you. And thank you, Dr. Kim. I look forward seeing you soon in East Coast. Make sure you bring some jackets, okay?
Oh, absolutely.
All
So
right.
looking forward to seeing you in person in a couple weeks.
Thank you. Such a pleasure. Thank you. Have a great day.
You too. Take care, and thanks
Bye.
to everyone for watching. Bye.
Bye. Bye-bye.